Guys, this is Mobeen. We are talking about restrictive lung diseases in respiratory pathology. Within that, the topic today is pneumoconiosis. Pneumoconiosis are defined as interstitial fibrosis that occurs due to inhalation of the minerals. So most of the time these are occupational hazards, and in that, for example, silicosis is world's most common or most prevalent occupational hazard disease. Now these diseases are also called non-neoplastic interstitial fibrosis due to inhaled minerals. So the important thing here is non-neoplastic, although asbestos we know can predispose to the mesotheliomas and the bronchogenic carcinomas. But the discussion of do they actually cause cancer or not, or for example, does silicosis cause cancer or not, this has been lots of controversy and discussions here. Although it is now admitted, it is now agreed on that silicosis does cause cancer. However, by definition we call them as non-neoplastic diseases. Okay, now their quality, all of these diseases here, we'll talk about coal miners disease, silicosis, asbestosis, we'll touch upon berylliosis as well. All of these are restrictive lung diseases. That means they are going to reduce the lung capacities, these are going to reduce the lung volumes. FeV1 over FVC ratio will be normal or greater, we've talked about it many times, and the normal clinical picture will be dyspnea, cough, and then cor pulmonale in the chronic situation, heart failure, and so on. So these are the normal pictures that would apply here from the interstitial fibrosis. So now let's look at this. As we look at the pathogenesis of all of these, keep this in mind. All of these diseases from a steps point of view have various important terms that you should remember. For example, when we talk about coal miners pneumoconiosis, anthracosis is an important term to keep in mind. Dust cells or black lung disease is an important thing to keep in mind. And then coal workers pneumonia or CWP and massive pulmonary progressive massive fibrosis PMF is also important to keep in mind. All of these diseases can be associated with the Kaplan syndrome. We'll talk about that, but what it is the interstitial fibrosis with rheumatoid arthritis. Similarly, if you go to silicosis, silicosis is associated with tuberculosis. There is macrophage damage, and that causes macrophage to be unable to handle tuberculous pathogen, and so tuberculosis is common. Eggshell calcifications are common, so the hilar lymph nodes become big enough and they look like eggshells, and there is a layer of the calcium with empty inside or non-calcified inside or center. Silicotic nodules, we'll talk about them today, and Kaplan syndrome here as well. In the asbestosis, same thing. It is basically the folks who are working on the old roofs, old houses, or naval ships, or with the roofing material, tiling material. So here the important thing with the asbestosis is to keep in mind is bronchogenic carcinoma, mesothelioma are associated with it. Then plaques, pleural plaques, ivory white, are pathognomic of the asbestosis. And then asbestos bodies, you might actually see a histological slide of that, and we see that as well over here. So, and Kaplan syndrome here too. So let's start. First of all, in pathology, in pathogenesis of all of these, the key cell to keep in mind is macrophage. So while you keep macrophage in mind, this big hero cell here or destroying cell here, other thing is to keep in mind is particle size. Particle size. And this is true for all of them. What does that mean? Normally the particles that are 5 micrometer to 10 micrometer, they can be inhaled, but they get trapped into the larger airways, and from there mucociliary elevator brings them back. We cough them out again. The particles that are 0.5 micrometer or smaller, they almost act as gases, and they can go in just like other gases all the way up to the alveoli and then come back out without any problem. So they are okay, these guys are okay. It is the particles which are 1 to 5 micrometer that are the most dangerous particles. These are the ones that cause the problem. So keep this in mind, write it down somewhere. The particle size has to be between 1 to 5 micrometer. These particles get lodged in the airways. So if I make an airway over here, so let's say this is the trachea, then we've gotten the, so let's keep making smaller and smaller airways, and finally we reach smaller bronchioles, then respiratory zones, and the alveolar sacs, alveolar ducts, and alveoli. So the 0.5 micrometer can go all the way and go back up. 5 micrometer to 10 micrometer will get trapped in the upper areas. This is the 1 to 5 micrometer. These guys are going to go in, and usually they get trapped at the bifurcations of the relatively smaller airways. Bifurcation is where they are dividing. That is where they get stuck. Why do they get stuck here? Because when they are going straight down, they would hit this bifurcation. Now when they hit there, they get trapped in the mucus there. Once they are trapped there, then the macrophages that are present in this area, and macrophages are present in this whole tree, they are present inside the alveoli. So for pneumoconiosis, remember there's both kind of macrophages, the ones that are alveolar macrophages and the ones that are respiratory tree or lung parenchymal macrophages. Both of the macrophages are implicated in this problem. What they will do is they will phagocytose these particles, and once again I'm speaking about all of them. The pathogenesis is kind of common. The cell is macrophage. The particle size is important. That should be enough to get stuck here. Now macrophage, once it eats up the particle, it can go through multiple events. In some cases, for example here in the coal miners disease, macrophage is actually happy, eats up the coal, digests it, and sometimes that coal just gets stuck in it. And now this macrophage has become a dust cell. So remember here, dust cell are important to keep in mind from the coal miners pneumoconiosis. Some of these macrophages, the dust cells, might actually run towards the lymph nodes. What are they going to do? They have friends in the lymph node. They're going to tell them, the T cells and the B cells here. So the macrophage has their friends in the lymph nodes. These are the T cells and the B cells. They are going to go and present these antigens to them. The result is the activation of the acquired arm. Inflammation would start, antibodies will be coming in, the T lymphocytes will come in. So what do you think? In this area, inflammation will happen or not? Yes. What kind of cells are you going to find? Macrophages and lymphocytes. What are the macrophage? What is specific for them? They would be carrying the crystals or these minerals in them. Where will the inflammation occur? The inflammation would occur in the parenchyma and next to the lymphatics. Why? Because the macrophages are moving through the lymphatics as well. So this is really important to keep in mind, lymphatics. So parenchymal inflammation and fibrosis and lymphatic inflammation and fibrosis will occur. Very simple, it's inflammation, right? And activation of the macrophages. This is the primary mechanism that will happen. So now keeping this in mind, let's look at all of these diseases and see what is different about them. Coal miners disease or coal workers pneumoconiosis, normally benign and inert. You have to be exposed to a lots of coal for it to reach a point where it causes the problem. And what is the problem? Enough interstitial damage and fibrosis to cause restrictive lung disease, which will mean dyspnea and the cough and the failure of the lungs. At the same time, because of the lung failure, there will be increased tension or hypertension, pulmonary hypertension will occur that would cause right heart failure as well. Now, anthracosis. What is anthracosis? We'll look at the slides for anthracosis today as well in this lecture, but basically it is the anthracose, so that is the carbon deposition. So anthracosis is really just the coal deposition or carbon deposition and the big black patches. Mostly this is benign. It is present, this disease can be seen in coal miners, of course. It can be seen in the large cities, so I made this little bus with the smoke. So cities where there is pollution and smoke and carbon, and then smokers themselves. And of course, you take a coal miner and make him a smoker as well, now you got a problem. The types are two: coal workers pneumoconiosis or CWP, normally benign, and then is the progressive massive fibrosis. Progressive massive fibrosis is a stage which is after the chronic occurrence of this disease, after the chronic exposure of the patient or the person to these minerals, and unfortunately, even if you remove them from that environment, once this disease has started, it would just keep progressing till it causes the death of the patient. So what it is progressive massive fibrosis. It causes interstitial fibrosis and it causes a lots of damage to the lung. Now, what is Kaplan syndrome? Again, Kaplan syndrome is common for all of them. Kaplan syndrome is an association of pneumoconiosis with the rheumatoid arthritis. So the patients of the rheumatoid arthritis have immune system abnormality. That abnormality makes them susceptible to other diseases that involve immune system. So here, if you have a patient who has rheumatoid arthritis and is also a coal miner, that patient would easily have Kaplan syndrome, where both of these problems would occur together, and the patient would have nodules in the lungs, rheumatoid nodules in the lungs as well. Okay, so that is the coal miners pneumoconiosis. Let us look at the lungs, almost blackened lungs of a coal worker. Okay guys, so look at this. This is the coal workers pneumoconiosis. Look at this lung. Do you see all these black patches? These black patches are the carbon laden macrophages or carbon crystals present inside the parenchyma. So this is the example of anthracosis. Then look at this here. This is another example of the pneumoconiosis, and again these are macrophages that have ingested the coal, and these are now the dust cells, and lots of dust cells are showing up here as anthracosis. So that is the pneumoconiosis lungs. This is actually a silicosis plus pneumoconiosis lung together. This patient unfortunately had silicosis plus coal miners pneumoconiosis plus superimposed tuberculosis, because silicosis actually can cause or predispose to tuberculosis. Okay, now the next disease, silicosis. This is usually common in the workers who work in the sand blasting areas or who work in the foundries, or even the miners, as I just showed you the lungs of a coal miner who also is exposed to the silicosis as well. Now, one important thing in this one, so pathogenesis is the same here, but important thing is tuberculosis or predisposition to tuberculosis. So question is, how does that happen? Look, so what happens is, it's very simple. The quartz crystals of the silica, when they are picked up by the macrophages, I'm going to make it a little irregular. So this is a macrophage. When these crystals are picked up by the macrophages, somehow these crystals or the reaction with the crystals causes the phagolysosomal activity to be down. So macrophage becomes damaged. when it ingests these silica crystals. And the result of that is phagoslysosomal activity of the macrophage becomes compromised. When that is compromised, macrophage, I hope you know that macrophages are the ones that would work with the tuberculosis pathogen. So when macrophage is damaged, it cannot handle the tuberculous pathogen, and that predisposes the patient to tuberculosis. Actually, in the early part of the previous century, the miners used to be really going through a very bad state, where first they would develop dyspnea, cough, and then they would develop tuberculosis, and that would be the end of it. The second thing that is interesting in the silicosis is that there is eggshell calcification. So why does that happen? So in the silicosis, what you would see is you would see silicotic nodules. Silicotic nodules are that there are crystals of silica present or trapped. You know that that is the function of macrophages in the inflammation, that macrophages try to gather around the causative agent that is causing harm, and they create a granuloma around it. So here a silicotic nodule is actually silica crystals in the center. Around that are the lots of collagen sitting in a whirling structure, and of course around that will be macrophages. And of course, because there was damage occurring, there will be lots of calcium. So in the beginning, these are small, barely palpable nodules, silicotic nodules. But if the patient stays exposed to silica, then, or the quartz crystals of the silica, then what happens is these start coalescing and they start making these big structures. These big structures finally can appear as if there is an eggshell calcification, in which the calcium is on the outer side, just like a shell of an egg, and inside are actually collagen fibers or just simply non-calcified material, mostly silica crystals. So that is what is the silicotic nodules. These are not anthracotic, meaning they are not carbon laden, and so they are not black. Usually they are pale and cheesy in their appearance, and you can actually palpate them if they are big enough, and they are present in the lungs as well. Now remember this, coal and silica, somebody had this little mnemonic which is really interesting. Coal and silica come from the earth, and they from below, and they involve the upper lobes or the lower parts of the upper lobes. Asbestos come from the roof and the other things, and it involves the lower lobes. So keep that in mind. Kaplan syndrome as well with the silicosis, same thing. If the patient is has rheumatoid arthritis, that means immune abnormality. On top of that, you expose the patient to the silica quartz crystals, and now you've gotten the interstitial fibrosis with the rheumatoid arthritis. Okay, so that is about the silicosis. Let's look at the silica affected lungs. Now let's look at the asbestosis or pneumoconiosis related to or caused by asbestos. Asbestos is seen nowadays in the old Navy ships, and their pipes have insulations of asbestos. Then the roofs, old houses, about 20, 30, 40 years back houses. Now the interesting thing with the asbestosis is this. Asbestos comes in two types of crystals. One are more flexible crystals, and the other one are straight crystals. So these are like serpentine because these are flexible and curly, and these are not serpentine, these are amphibole. So spellings are wrong here. Amphibole crystals. Amphibole crystals are actually amphibole. These straight crystals are more dangerous. What happens is when the patient or the person inhales them, these serpentine crystals get stuck early on in the airways. They get stuck early in the airways, and most of the time they are picked up by the mucociliary elevator and they are thrown out, or they are picked up by macrophages and are removed. However, the straight ones, They're small, they're stiff, they're straight, they keep going deep, deep, deep in the lungs, and they reach almost the alveoli and the respiratory zones. These are the ones that cause a lot of damage as well, and they predispose the lungs towards the mesothelioma and bronchogenic carcinomas too. So amphiboles are more dangerous than serpentine. Amphiboles are more fibrogenic as well. So now remember this, out of all of these, asbestos and silicosis and beryllium are more fibrogenic compared to the coal. You have to be exposed to lots of coal to have the damage, but very few of the, less exposure to this would cause equivalent to more damage. Now let's look at the problems that happen with the asbestos. So in the step 1, plaques is the most important thing to remember, almost pathognomic. So here, let's say this is a lung or 2 lungs. The lower part of the lungs and the anterolateral pleura of the lung will develop ivory white plaques when the lungs are exposed to asbestos. Benign plaques, sometimes they would actually have the pleura connect with the domes of the diaphragm, but if you see them, that is a pathognomic situation to say that this patient has asbestos. Now, asbestos bodies are also very important, and you might actually see them in the exam. What these are bead appearance bodies which are covered with the brown ferritin or iron on them, and mostly present in the parenchyma or the macrophages. And the patient's sputum, or if you collect the lavage, you would see these bodies to be present. What these are, I'll show you a slide. So they look like this, they have a beady appearance, and they look like this, and they look like rusty. And what these are when macrophage is trying to ingest them or phagocyte them, when macrophage is trying to eat them, macrophage releases iron. That iron or ferritin gets coated on the asbestos crystals. So these are called ferruginous bodies. Ferruginous bodies. I think my spellings are wrong, but anyways, so these are also called the asbestos bodies. These will look like bead appearing stuff. Now, what is important about the asbestosis or asbestos related pneumoconiosis? This is for sure a disease that increases the chances of bronchogenic carcinoma by 7 times, and mesothelioma about 1,000 times. 1,000 time increase in the mesothelioma. So what is mesothelioma? So this is the pleura, visceral pleura, and then we have the parietal pleura. The surfaces of these pleura, both for peritoneal and pulmonary pleura, these are normally squamous cells, and these cells are called mesothelial layers. Mesotheliomas are the cancers of these cells. So most of the time in the asbestosis, you would see very thick pleura with the calcified plaques, and mesotheliomas chance increased by 1,000%. Okay, so let's look at some of the diagrams related to this. Okay, so look at this. This is asbestosis, and you have ferruginous bodies. Do you see these bodies here? These are the ferruginous bodies. What are these? These are engulfed by macrophages, and these were asbestos crystals. Macrophages coated iron on them, and let's look at a more closed up view. See this, the beady appearance, and the macrophages, these are all sitting around, and they have been coating it while trying to phagocytose it. So no single macrophage could phagocytose that, but every bite they took, they left their saliva on it, and that is the ferritin, and the end result is this beady appearing crystal that is called the ferruginous bodies. So that is the asbestosis for you. Thank you.